Tonight on Capitol Hill, tensions flared during a heated committee debate as Representative Chip Roy delivered a fiery critique of Democratic healthcare policies. Representative Roy began by pushing back on claims from the committee's ranking member, who argued that Republicans own the current state of the healthcare system if they fail to support additional subsidies. Roy countered that the existing system, along with what he called its failures, was created entirely by Democratic votes and Democratic policy decisions.
Mr. Roy, you're recognized.
Notice the ranking member says that, quote, we own this.
You do.
If we don't go down the road that is being suggested here before us, when in fact, the current situation with respect to health care exists entirely by record of vote and record of policies as a result of my Democrat colleagues putting forward the policies that the American people are having to live under. Entirely. They broke the system, and then they come here saying that we own it if we don't throw more subsidies, pour more diesel on the fire, to the fire that they started. That's what's happening right now. That's what for the American people to understand. Insurance companies.
Bail out Argentina.
Insurance companies, 1,032% stock prices up since 2010. 448% up from 2013. 85% of the revenues for insurers come from the federal government. What my Democratic colleagues are proposing is an insurance company enrichment scheme. It's literally what they're doing, is printing money in the Treasury and giving it to insurance companies. That's their solution for healthcare. Enriching insurance companies that are the very people that are telling the American people which care they can get and not get. There's no chance for an American to go to the doctor of his or her choice. There's no chance for them to go get care. There was no chance for my constituent who lives near Fredericksburg, Texas, to go to MD Anderson to get care because she's on Obamacare, which can't go to MD Anderson. And if the cancer that I had when I went to MD Anderson came back and I'm on Obamacare as a member of Congress, I couldn't go to MD Anderson because of the situation that my Democratic colleagues have put the American people in. Going around and preening that you're somehow caring for people more by giving them coverage for care that doesn't actually provide them care. While insurance companies get rich. $35 billion in subsidies in 2024 for people who didn't even use their plan. It's absolutely unconscionable. That is right. That is the correct word. It is unconscionable what we have done to the healthcare system, destroying it for the American people so that they can't get the care of their choice. That's what's happened. And now you hold the government hostage for 45 days and then try to come lecture Republicans about it when you've been holding the American people hostage to a broken healthcare system for 15 years. That's what's been going on. The fact is, Madam Chairman or Chairwoman, we are here today trying to proceed with, I think, reason, with 3 appropriations bills combined with a continuing resolution through January. After having tried with reason to fund the government through November 20th so that we could continue the debate on the various issues in question. But our Democrat colleagues refused to do it. And so now we've got the opportunity in front of us to extend, fund government at current levels, roughly flat, trying to stave off the inflation that is the direct consequence of the massive amount of government funding that has been going on by both sides of the aisle, but heavily being promoted from my colleagues here on the other side of the aisle, who want us to throw another $1.5 trillion at it. That's literally what they were saying. It's not a solution. That's just printing more money while trying to go run campaign ads why you shut the government down for very clearly and obviously political purposes. I yield back, Madam Chairman.
Madam Chair, I wish the gentleman had that passion condemning the $40 billion bailout of Argentina, the right-wing cuckoo clock in Argentina. I wish he had the passion to condemn that.
Mr. McGovern and Ms. Scanlon, you're recognized.
He accused his colleagues across the aisle of breaking the system, only to return asking for even more federal subsidies, which he described as pouring diesel on the fire they started. Roy sharply criticized the insurance industry's financial gains over the past decade, pointing to soaring stock prices and the fact that a large portion of insurer revenue now comes from federal dollars. He labeled the Democrats' proposal an insurance company enrichment scheme, arguing that their approach prints money from the U.S. Treasury and hands it directly to insurers. The congressman also raised concerns that patients are losing access to the doctors and medical facilities of their choice. He cited a constituent who, he said, was unable to receive care at MD Anderson due to limitations under the Affordable Care Act. Roy claimed he himself would be denied access to the same hospital if he were enrolled in an ACA plan. He went on to condemn what he described as billions in subsidies paid out in 2024 to individuals who never used their health care plans, calling the situation unconscionable. The debate then shifted to government funding. Roy argued that Republicans attempted to pass a temporary funding measure to keep negotiations going, but said Democrats refused, leading to a last-minute scramble to prevent a shutdown. He criticized what he viewed as Democratic attempts to push for $1.5 trillion in additional spending, which he said would worsen inflation and allow for political messaging rather than responsible governance. As Roy concluded his remarks, the committee chair recognized another member, who responded by questioning why the congressman did not show equal outrage over what he described as a $40 billion bailout involving Argentina. The floor then shifted to additional members for further commentary.